Okay, so we're going to assess her lochia. And we do that just by pulling her pad down and looking. Now, this is the amount of lochia that's on her pad is relative. So we need to know, how long has this pad been on? If this pad is completely saturated and she's had it on, you know, for the last 8 or 10 hours, that's not nearly as concerning as if she just went to the bathroom 20 minutes ago and changed her pad and now it's completely saturated. So we definitely need to know what is the time frame associated with the amount of blood that we're looking at. Remember, we're looking at color, amount, and odor. There should not be a foul odor associated with the lochia. And we're expecting, while she's in the hospital, that we're likely going to see lochia rubra. And then remember, it progresses on to serosa and then alba. We're not going to completely finish our assessment of the lochia until we've had a chance to look, turn her over on her side, and we also want to look at the chucks because there could be a big pool of blood underneath her in addition to what's on the pad. So we need to be aware that there are other places that there might be lochia. Okay, and then we have our E, which is episiotomy. And the position that we get our moms in to assess the E isn't just limited to episiotomy. It could also be laceration, or if she doesn't have an episiotomy or a laceration, we still want to inspect her perineum, the perianal area. So we would look at that on all of our moms. Even if she's a C-section mom, we're going to want to assess the perianal area. So we're going to have mom lay on her side, and her lower leg will be straight, and the upper leg will be bent and kind of pulled forward. So then we're able to view very well her whole perianal area as she's laying on her side. So again, we're looking at the chucks to make sure that there's not a lot of blood there as well. And then we're looking at the perianal area. If she had an episiotomy or a laceration that was repaired, you know, what does that site look like? Is it well approximated? Is it red? Is it edematous? Is there bruising? Is there any kind of discharge? And we're also looking for hemorrhoids. Does she have any hemorrhoids? Again, as we're doing this assessment, we are giving her our findings and providing anticipatory guidance. So as we palpated the uterus, we would tell her what we're finding and how we expect the uterus to involute or move down to its pre-pregnant size and placement. As we're looking at her perianal area, we're going to be talking about what we're finding and also any comfort measures that are available that would be pertinent for what we're seeing on our assessment. As we have mom in this position, this is a really good time to check her epidural site if she had an epidural. If she was a vaginal delivery and had an epidural in labor, then likely at this point the epidural is out, but we still, it would be in the lower back, we still want to check that site for any signs and symptoms of infection. If she had a C-section, and then she would likely have an epidural in for post-operative pain. So we want to check that site. We want to check for patency as well. All right. Then we move on down and we have H for Homan's sign. And what we're trying to assess is if she has any leg pain as we do the Homan's sign. We have to assess both legs to get a full assessment of what's going on. So we support behind the knee and we quickly dorsiflex the foot. And then we ask if she has any pain when we do that. Now, if she has pain, that doesn't necessarily mean, that's not necessarily diagnostic of a clot. It could be that she's just very sore from the labor process. So we would want to look for other clues. We would want to look for any redness or warmth on her legs. Also, as we're down here at her feet, we want to assess for edema. We want to assess pedal pulses as well. We also need to ask our mom about her leg sensation. If she had an epidural, or she still has an epidural for post-delivery pain control, then she might have some lingering numbness. So we want to know what her sensation is like. Is she still having some numbness? Is she having any difficulty with ambulation? So we would assess that as well. And then our final assessment is going to be E, which is her emotions. And this is really kind of a psychosocial assessment. We want to know how she feels about the delivery, how she feels about baby, becoming a mom, those kinds of things. We also want to know what kind of help does she have. Does she have anyone staying with her here in the hospital? Does she have plans for someone to come help her when she goes home? How long will they be available? Does she plan to go back to work? How long till she plans to go back to work? Those kinds of things. So we're not just necessarily focused on sadness and blues and maybe emotional trauma from the delivery, but we're also wanting to hit the social part of it as well. What kind of how are her relationships and what kind of help does she have? Okay.